Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Nwaka. First, the highlights. NCDC reports over 2,000 recoveries in the last 24 hours as government works to scale up vaccination efforts. Governor Wike threatens to reimpose fresh lockdowns in rivers if residents fail to comply with the non-pharmaceutical interventions. On Sunday night, new cases confirmed by the NCDC showed 459 cases reported from 19 states and the FCT. Nigeria's commercial hub and the epicenter of the pandemic, Lagos, reported the highest daily tally of 185, followed by 38 cases each in Abia and Oyo states. On Saturday, the country recorded one of its highest figures since the third wave started, close to 1,000 cases. While the death toll is also climbing now, edging close to 3,000, active cases have significantly reduced since a week ago. Here's more on the update.
The latest data from the Nigeria Center for Disease Control shows that the daily COVID-19 infections in the last 24 hours are at 459, with the spread of the Delta variant in the country. The latest figures were reported from 18 states and the FCT, indicating a drop from the figures reported earlier. Lagos had the highest number of cases with 185 infections. 38 cases were recorded in Abia and Oyo states. Akwa Ibom and Cross Rivers had 33 each. Osun had 24 cases, while Ekiti reported 23 cases. Benue recorded 15 cases, Kwara 14, Kano 12, 10 cases were reported in Delta and the FCT, and 9 cases were reported from Edo. Other states include Kaduna with 5 cases, Ogun had 3 cases, Katsina, Nasarawa, and Rivers recorded 2 cases each, while Bayelsa recorded 1 case. There were 0 cases reported from Plateau and Sokoto states. Nigeria now has a total of 195,511 confirmed cases. 2,066 people have been discharged in the last 24 hours, increasing the total number of recoveries to 184,529. 8 additional deaths from COVID-19 complications were reported in the last 24 hours, raising the fatality toll to 2,552. The latest update also includes a backlog of 23 deaths from Lagos State for September the 3rd. Presently, there are more than 8,000 active cases in Nigeria, while over 2.7 million samples have been tested so far. Over 911,000 eligible Nigerians have been vaccinated with the first dose of the Moderna vaccine, while over 123,500 eligible Nigerians were vaccinated with the first dose have received the second dose of AstraZeneca vaccine. The total global confirmed cases have now surpassed 220 million, while more than 4.5 million deaths have been reported.
River State Governor Wike is threatening to impose fresh lockdown on the state if residents fail to comply with the non-pharmaceutical interventions. Governor Wike hinged the threat on the scary increase in the daily figures of COVID-19 infections and fatality. He's urged all residents, including religious leaders, to encourage their followers to take the vaccines to prevent a further spread. The River State Governor gave the directive during a televised broadcast in Port Harcourt, the state capital.
Clearly, we are headed for a serious health disaster of profound consequences if residents and visitors continue to behave as if the pandemic no longer exists or impotent in River State. This is a big lie, and we cannot afford to continue to close our eyes to the dangers such irresponsible behavior poses to the health, lives, and livelihood of everyone. Accordingly, I wish to remind residents of the subsisting protocols on regular washing of hands and use of alcohol-based sanitizers, maintaining our social distancing, wearing of face masks at all public places, including transport vehicles, and going for immediate testing and treatment whenever you notice any of the symptoms. I therefore appeal to all residents to help protect yourself, your loved ones, and the rest of the citizens by getting your vaccination at the designated health centers in the state. Although it remains our desire to keep the state open and allow citizens to go about their social, religious, and economic activities unimpeded, but may be constrained to reimpose suspended COVID-19 lockdown measures across the state if the transmission of the disease continues to increase beyond tolerable limits.
And the second phase of vaccination against COVID-19 has commenced in Ebonyi State following the receipt of over 42,000 doses of both the AstraZeneca and Oxford brands of the vaccines. Commissioner for Health, Dr. Daniel Mizurike, disclosed this in the Abakaliki, the Ebonyi State capital. He further hints that the state successfully completed utilization of the first batch and assures citizens of the safety of the second. The commissioner also calls on those yet to be vaccinated to take advantage of the opportunity.
The process has been very good and people have been turning out to get themselves vaccinated. And this time around, like when we started in the first batch, we prioritized the elderly, the frontline health workers and strategic leaders. But this time is open for everybody. Once you are above 18 years, you go to the nearest health facility and get inoculated. And the vaccine we are using is Moderna and the AstraZeneca. So the AstraZeneca is basically for the people that may have taken the first shot and they need to complete the second dose. The Moderna is for people that are starting their first dose. So, and the quantity given to us is 41,596 doses for Moderna and 10,000 doses for AstraZeneca. And prior to the commencement of the exercise, the cold chain equipment, the ultra cold chain equipment has been stored and is perfectly in order in Ebonyi State.
In Ekiti State, the government is further engaging traditional rulers and community leaders to strengthen campaign about COVID-19 protocols and vaccination. Our correspondent Babajide Agbera reports that an assessment shows political gatherings will need more monitoring so as to check violation of set safety interventions.
The government of Ekiti State is going up a notch in the sensitization of residents about compliance with COVID-19 protocols. A team has been going around across local governments in the state to sensitize traditional rulers who in turn are expected to enlighten their subjects on the need to take responsibility, adhere to protocols, and embrace vaccination. At the arena of politicians, more work needs to be done. Although government events have been witnessing substantial compliance with COVID-19 protocols, recent political party congresses held around here did not, however, reflect much of this compliance, despite words of advice from supervisory officials.
Yes, we have told them to abide, to follow the protocol strictly. We have told them that during especially at the Congress venues, that the COVID-19 protocol should be adhered.
With stronger mobilization, traditional rulers and political leaders may add to the effectiveness of the campaign for compliance with these protocols by leading from the front. Babajide Agbera for COVID-19 update.
Well, for more on the pandemic outlook in Ekiti State, Dr. Jim Lass-Ogunshaki, Senior Special Assistant, Public Health and Lead Compliance Officer for COVID-19 Task Force in Ekiti State, joins us virtually from the state capital. Thank you for joining us on the program.
Thank you. Good afternoon, good evening. Yeah.
All right, good evening. Ekiti State has been very big on sensitizing people about COVID-19 protocols in the state. But how much are residents listening and adhering to the safety measures?
Thank you. On the 10th of August, Mr. Governor, His Excellency gave another directive, like a restriction order on social gatherings, religious gatherings and other gatherings in the state because of the third wave and because of the numbers that we were having in the state, because our positivity rate had increased. So these have made us to go back to the street, and we started enforcement again. This time around, of course, institutional enforcement, especially business areas, and of course a lot of places where people gather, religious gatherings, social gatherings, and all of that, where people had already thrown away the protocols, but we started resensitizing, and of course we've been engaged with the communities, especially the traditional institution and the religious leaders. We've had several meetings across the local government. And of course, we've also taken some drastic enforcement actions on some businesses in the state, and for them to know that government is very serious about the compliance of the restriction and the rules.
But for large gatherings, including political gatherings, they tell a whole different story, especially these days. What is the task force approach to such crowds? And this is also looking at the future.
Yeah, so because there is no complete lockdown at the moment for the gatherings, so what we do is that we ensure that strict COVID protocols are being followed. By that, I mean, ensuring hand hygiene. So we position vertical buckets and other hand washing equipment and make sure that everybody wash their hands. And we enforce the use of nose mask. And of course, the social distancing. We had shut down a few gatherings that are not compliant. We even went ahead to institute a kind of a permit for parties and all of that. So we make sure that since we are not having a lockdown and all of that and its restrictions, so we make sure that people comply, and we walk into events and gatherings to make sure that people comply. Yeah.
Let's talk about the vaccines as ongoing. How are people reacting to it? Are there people who are opposed to the vaccine? And if so, what are the plans to reaching out to a lot more people to take the vaccines?
Okay, yeah, about the vaccines, in the beginning, when the vaccines newly came, we had quite a lot of misinformation and all of that. But that had really come down now. Even when we completed the first phase of the AstraZeneca vaccine that was brought then, quite a lot of people were still coming that they wanted to have their vaccines. So, but recently we received Moderna and another batch of AstraZeneca vaccines. Our vaccine uptake in Ekiti has been encouraging even from the first dose, because we did quite a lot of community engagement because of the narrative of our environment, because of the respect that people have for the traditional institution and the religious institution. We always engage them to make sure that the message goes around across the nooks and crannies of all the communities in Ekiti State. So as we speak, we have had in the initial time, we had AstraZeneca, we had like about 70,000 doses. So we had like about 30,000 uptake in the first round, and we had another 20,000 uptake in the second round. So for people that couldn't have their second dose, this new AstraZeneca that we've just been given is about 24,520 doses. And we have encouraged people that have not taken their second dose of AstraZeneca to come take their AstraZeneca second dose. And also people that are also willing, because people are also willing to take their first dose, we've been giving them Moderna. Moderna gave us 47,404 doses. And up until yesterday, because the C-Trek will be going on even as I speak, we have utilized about 30,508 out of the 47,404. And the Moderna vaccine is actually like 28 days interval. So we're hopeful that we're able to utilize it before September 16th or so when it goes out. But for the second phase of AstraZeneca, out of the 4,520 that they gave us, we had actually used about over 5,000, almost 6,000, and we're still making progress.
All right, we'd like to thank you for that update and wish the state the best in the fight against COVID-19. Thank you so much. We've been speaking to Dr. Jim Lasagushake, Senior Special Assistant, Public Health, also Lead Compliance Officer for COVID-19 Task Force in Ekiti State. Thanks again.
Thank you.
The COVID-19 pandemic has posed a global economic challenge affecting all human interactions due to the lockdowns in many countries of the world. This has resulted in temporary disruptions to market development initiatives. Well, President Muhammadu Buhari made this known today during the 47th African Insurance Organization Conference and Annual General Assembly. The president, who attended virtually, says Nigeria is making efforts to check the spread with ongoing tests and vaccinations.
Coronavirus is still a serious challenge in many countries across the globe. However, adequate protocols have been put in place to curb its spread, and vaccination is in progress. We understand as a government and nation the need to frontally tackle some of the disruption to our social, economic, and health occasioned by the pandemic by putting in place sufficient measures that allow the system to function. I once again use this opportunity to commend the Nigerian insurance industry for identifying with the government through the provision of life insurance set of packages for frontline medical and paramedical personnel in the cause of this fight. Your support and solidarity in these times is highly appreciated. The theme of your conference is very apt and well thought out, rebuilding Africa's economy and insurance perspective. It is looking at the reality of the moment, as many governments are trying to devise ingenious ways of managing their economy in the aftermath of the pandemic.
Nigeria's President Muhammadu Buhari speaking there. Away from Nigeria, the U.S. is recording an average of about 150,000 infections each day in the recent 7-day period, according to latest U.S. Centers for Disease Control and Prevention data. The 7-day moving average was 153,246 on Sunday, which was 123.6% higher than the figure approximately 1 year ago and 1,217.0% higher than the lowest on record on June 18, 2021, since the pandemic began. Our Washington correspondent Maria Bird brings us the latest.
U.S. healthcare workers are beginning to experience post-traumatic stress disorder as they battle through a rise in COVID-19 deaths.
This year, I've definitely put a lot more people in body bags than I would like to in my whole lifetime. We're all tired. We all just try and take care of each other.
We come to work every day.
Good.
And we know it's going to be a hard day. Every day is going to be a hard day. I'm just anxious about what the day is going to bring. What's going to happen? Who's going to die?
While hospitals are running out of ICU beds, more than 60% of Americans are potentially eligible for a booster vaccine. As Americans anticipate receiving either the Pfizer or Moderna booster, research suggests that there is only sufficient evidence for the Pfizer booster vaccine.
This will boost your immune response. It will increase your protection from COVID-19. It's the best way to protect ourselves from new variants that could arise.
The White House continues to advocate for all Americans to get vaccinated, while previously vaccinated Americans are already making appointments to receive a booster shot, hoping to increase their protection from the Delta variant. From Washington, Maria Bird, Channel Television News.
Maria is with us now. Hi, Maria. How badly affected are the mental health of care workers under the pandemic? And really, how is the CDC government reacting and trying to solve this problem?
Thank you for having me. Yes, the mental health perspective of this has really taken a major toll on our healthcare professionals. As you saw in the piece, the nurses, the doctors, they are completely overwhelmed with knowing that in some ICUs and hospitals, you're talking about 90% of the people in ICU that come in with COVID, especially the Delta variant, are not leaving alive. And so that, I think, has taken a major impact on the mental health piece, especially as you think about some of these doctors and nurses are working, much longer shifts. They might be working 16 hours a day. Some of them are doing 2 shifts, so they're in the hospital for almost 48 hours at one time, and maybe taking small breaks in their break rooms. And so when you even talk about kind of their exposure to anything outside of COVID, it's very minimal. And so this is a major concern to the CDC. It's especially a major concern for many hospital administrators, because they're beginning to see that some of their high-performing doctors and nurses are now having to deal with the mental stress of it all and are not able to necessarily be as available for the patients and in their care for the patients.
And so in terms of booster shots, how rapid are they going around, especially for the vulnerable, to help in reducing ICU visits? Because WHO, for example, and the EU have said that booster shots shouldn't be a priority now.
Yes, we know the global community has not necessarily looked at the shots as a priority. Where we are in the U.S. is some of the factors that many of the individuals that are entering these ICU and entering the hospital are unvaccinated. And so the issue is not a lack of vaccines. The issue is a lack of people taking this extremely seriously and getting vaccinated, or either seeing what the benefits are for them to be able to be vaccinated. And so the boosters are those individuals who've already been vaccinated, and the research is now showing that a booster is needed. We know that there's limited information on the Moderna, but definitely with Pfizer. But they have had some boosters with Moderna for those who had underlying conditions or were of the elderly population, but we will probably begin to see that disseminate quite quickly as they really move toward the September 20th full release of the boosters for anyone that has been vaccinated, and those will most likely be the Pfizer boosters.
Finally, Maria, for the unvaccinated and those who do not want to take the vaccine, what are the options for eating out, for travel, for schooling?
Yeah, so many organizations, school districts alike, who have mask or vaccine mandates are also including with that, if you're not vaccinated, a testing requirement. So whether it's every 3 days, whether it's once a week, some are less frequent than that, there is a actual testing requirement. The challenge, though, is that the U.S., unlike what we are with vaccine availability, we are limited on the number of available tests. And so COVID-19 tests are now becoming very hard to secure. And so that is going to create a greater challenge as we move forward for those who are unvaccinated, who will need to have a vaccine test on a very regular basis. But as you said before, there's some areas like in New York, they're requiring vaccine cards to enter certain restaurants. So for those private establishments, you will definitely see the unvaccinated beginning to slowly be removed from being able to attend or to visit those sort of establishments.
Our Washington correspondent Maria Bird there. Thanks a lot for joining us.
Thank you.
And now Pfizer COVID vaccines have arrived in Australia under a United Kingdom swap deal. Australia is trying to secure more vaccine supplies. This is amid a surge in cases that has locked down 2 of its biggest cities. Well, let's take a look at more stories from around the world.
We begin in Venezuela, where President Nicolas Maduro says the country will be receiving the first coronavirus vaccines obtained via COVAX. The South American nation has been inoculating its population with doses acquired directly from China and Russia, following months of delays in making payments to COVAX that Maduro has attributed to U.S. sanctions.
Cabinet has agreed that all of New Zealand beyond...
Over in New Zealand, Prime Minister Jacinda Ardern says nationwide coronavirus curbs will be lifted with exception of the biggest city of Auckland, as the country gets on top of an outbreak of the Delta variant. The country has been largely virus-free, excluding a small cluster of cases in February, until an infected traveler from Australia seeded an outbreak that prompted Ardern to impose the national lockdown last week.
We're likely to reach a peak in cases in the next
Speaking of Australia, the New South Wales Premier says daily infections are expected to peak in the state next week as they look to speed up immunization ahead of easing restriction. She says the government's modelling revealed that the state will require its highest number of intensive care beds in early October, with additional pressure on the system in the next few weeks. Finally, renowned U.S. economist Jeffrey Sachs says the United States needs to work with China to find a solution for the world in the fight against the pandemic. Sachs, who is also head of the Lancet COVID-19 Commission, pointed out in an interview that one of the reasons the world has not responded appropriately to COVID-19 is the failure of the United States to work with China to find a global solution. He says the United States should learn to work cooperatively with China rather than trying to impose its will on the country.
The coronavirus can live on the surface for several hours. Continue to take responsibility. You can visit our website. It's channelcv.com for the latest stories. We have breaking news. Also, you can find a better understanding of the pandemic with the updates. It's at your fingertips. That's the program this evening. Thank you for watching. I'm Millicent Walker. Stay safe.